Good morning, everyone, and thank you for joining us. We called this briefing today to announce some changes that will be coming into effect this month. Based on several indicators, we are seeing reduced COVID-19 activity in the province. Hospitalizations due to COVID-19 severity have decreased significantly in recent weeks, which is one of the most important indicators at this time. And while the virus persists, the level of community transmission is lower than we have seen in recent months. We committed to reviewing masking in schools this week, and public health continues to strongly recommend wearing a mask to reduce your risk of COVID-19 and to reduce its transmission. However, based on our epidemiology and on discussions with the Department of Education and school districts, effective Tuesday, May 24th, so that's Tuesday after the long weekend, masks for K-12 students will be a personal choice for staff, students, and families, and no longer required. We encourage individuals and families to make a risk assessment in their decision to wear a mask. And the following questions really are important to consider when you're making this risk assessment. The first, are you up to date with your COVID-19 vaccines? Up to date with your COVID-19 vaccines means you have received all the recommended primary series vaccines, and that includes, and then any boosters on top of that are recommended for you. So if you answer no, you should consider wearing a mask at school. Do you have you had COVID-19 in the last 3 months? We know that reinfection is less likely in the 3 months after you've had COVID, although not impossible, but much less likely. So if you answered no to this question, you should consider wearing a mask at school. Are you considered to be in a high-risk group, or do you live with a person who is in a high-risk group? And if you answered yes to this, especially if you're not up to date with your COVID-19 vaccines, you should consider wearing a mask at school. And will you be attending a crowded indoor event at school? Large crowded settings where there are many people close together increase the risk of spread of COVID-19, especially if it's indoors. So if you answered yes to this, you should consider wearing a mask at school. Wearing a mask also protects you from other respiratory viruses that are circulating, such as influenza. And regardless of your choice or anyone's choice to wear a mask or not, we ask that students and staff be kind to one another and respect each other's choices. Remember, we are all moving through this at our own speed and have our personal reasons for making the decisions that we do. Masks will continue to be required in all healthcare facilities, including long-term care and personal care homes. And additionally, we will be modifying the schedule for updating the COVID-19 data hub, and it will now be updated once a week on Wednesdays. COVID-19 will be with us for the foreseeable future, and right now we're in a good place. A large proportion of our population has gained immunity from exposure to COVID-19, as well as through vaccination. Respiratory viruses generally subside when the weather outside warms up and people spend more time outside. However, we know that COVID-19 immunity does wane with time, and we expect that COVID activity will increase again at some point in the future. So if you are eligible for your first or second booster, please make the time now to get that dose so you have that extra level of protection. A booster is an added protection even if you have had a COVID-19 infection. For now, we are optimistic for a relatively normal summer, and after the last 2 years, that is a very welcome reprieve. So I'll now take questions from the media.
Thank you, Dr. Fitzgerald. We have 4 reporters joining us today. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions today are from Peter Cowan with the CBC. Peter, please go ahead.
Dr. Fitzgerald, you said it's a personal choice. What do you say, though, to families, for example, who are worried that their kid may still wear a mask, but because other staff or students aren't wearing a mask, they're now more likely to still contract the virus and bring it home?
So I think we have to remember that we're dealing with relatively highly vaccinated population. We also have a level of immunity that comes from exposure to COVID-19. So there is, the risk is lower, and certainly what we're seeing with regard to circulating virus right now indicates that the amount of virus circulating is reduced. So I think while I do understand that people may have concerns in that regard, I think wearing your mask yourself certainly will give you protection in addition to all those other things.
Do we have a sense about what percentage of the school-age population have had COVID? There have been some national numbers that have shown that the prevalence is quite high in those age groups. Do we know what it's been like in Newfoundland and Labrador?
Yeah, so a lot of that information is coming from what we call serology studies. So they're looking at, how many people have certain antibodies against, there are certain antibodies that you'll get against the vaccine versus others that you will get from exposure to COVID and contracting COVID. So a lot of that information is coming from there. We haven't had any of those studies at this point, but certainly from what we've seen with regard to circulation in school, we do expect that the amount of immunity due to COVID exposure and infection is relatively high.
Our next questions are from Ben Cleary with NTV. Ben, please go ahead.
Hi, Dr. Fitzgerald. Thank you. What would you say to a concerned parent or teacher who said, why didn't we wait until the last day of school on June 23rd, considering it's only, just a little more than a month away?
So I think we're always, as we've said many times before, we're trying to balance, recommendations and guidance with rights and freedoms, and so I think we need to make sure that what we're doing is the least restrictive means possible. So while we're still recommending this and strongly recommending masking, we do recognize where we are right now with epidemiology, and immunity allows us to make this recommendation for personal choice. And we're always looking at things, and I think that that people have been very, very good at wearing masks. I mean, I'm still seeing lots of people wearing masks when they're out in public, and so I think that for most people, those trends will continue.
Thank you. And to add on Peter's question as well, do we have an estimate, or do you know how many people in the province to date have had COVID, or what percentage?
So the estimates that we have based on the modeling, or the predictions that we have based on the modeling, is that it's about 4 to 6 times more than what we've had in total cases. I think at this point our total cases are around 40,000. So it will be 4 to 6 times that is what we expect in the general population.
Our next questions are from Peter Jackson with the Telegram. Peter, please go ahead.
Good morning.
Morning.
Do you think it's realistic to think that peer pressure won't be a major factor when it comes to wearing masks in schools?
I think we've learned a lot of things over the last 2 years. I think that, children have gotten used to wearing masks. I think some of them have gotten comfortable with wearing masks. I think we have seen a lot of kindness and a lot of support for one another. So I'm very hopeful and optimistic that that will continue. And I think that as parents, we have to be able to support our children and to give them the tools that they need to be able to make good decisions as well, and make good choices. And I think we can all, like our school communities and our communities at large, can certainly help to support that. But I think that today's kids are more accepting and more accepting really of personal choices than ever before. So I have great hope.
Thank you. And you mentioned rights and freedoms. That would suggest that there is a lot of pressure to release this. Why are you making this decision at this point?
So No, I wouldn't say there's a lot of pressure. That's not why we're making the decision. We're making the decision because the legislation, because our code of ethics tells us that we have to, the decisions that we make have to be proportional and responsive to what the risk is. And so that's why we're making that decision. And we always knew that, once we started to see the downslope and once we started to see improvement in our epidemiology, that we were going to make decisions about masking. So so that's the reason behind it.
Our next questions are from Noah Shepherd with VOCM. Please go ahead, Noah.
Hi, we've seen a high number of cases stem from the school system. What will we have to see change in the epidemiology to, say, reintroduce the mask mandate?
So we have seen a lot of cases in school-age children. I don't think that it's fair to say that we've seen it come from the school system, in that, it certainly, I'm not saying there hasn't been any spread in schools. I'm sure there has been, and we're certain that there has been spread in schools, but a lot of spread also happens outside of schools. And so we have a group of people who are very social with each other, who do lots of activities outside of school together. They're good friends with each other. They hang around together outside of school. So there's a lot of transmission that happens in those regards as well. With regard to what we'd have to see to bring masking back, I think we would have to see a significant change in epidemiology and increase in cases, and then more sustained community transmission, which we're watching very closely for, obviously.
And you mentioned earlier the modeling. How do we expect COVID to trend this summer, considering the come home year and the limited masking restrictions? What's the modeling suggesting?
So at the moment, it looks like our trajectory is quite favorable and that it will go down. We're not going to get down to zero. That's not the expectation. In a lot of other scenarios previous to this, we've gotten things down to pretty much zero and very limited transmission, just within families or close contacts, that sort of thing. That's not what we're anticipating seeing, and that's not what we're trying to achieve at this point. But we do expect that the level of transmission will be reduced to a sustained, manageable level. That we will likely continue to see some hospitalizations, but that will be manageable. And so, that's the anticipation throughout the summer. And then we do anticipate, once the fall comes and the colder weather and other viruses start circulating as well, and people start moving back indoors, that we're likely going to see some more transmission of COVID, and then likely for other respiratory viruses as well, such as flu and RSV.
I will now go back through each reporter to see if you have one final question. Peter Cowan with the CBC, do you have a final question today?
Yeah, I do. Dr. Fitzgerald, I've already seen some parents saying that they're considering now pulling their kids out of school for the last couple of weeks if it means that the rest of the class and the teachers aren't masked, because they're afraid or concerned that this will increase the risk of transmission. What would you say to parents who are trying to make that balance and may be inclined to remove their kids from school over this?
So I think the most important thing to remember here is that everybody has to make their personal choices based on their own situation. We in public health would not be doing this if we felt that there was a significant increased risk for transmission. As we've done throughout Omicron in particular, when we've loosened restrictions, there may be a little bump. That's not unexpected, but we don't anticipate there's going to be a huge increase in transmission with this. So I think, we are certainly, while I understand people's concerns, I think the evidence right now and our epidemiology right now is saying that this is a good time. And I think it's really important for children to be in school, and we have to weigh the risks and benefits of both of these things. So getting COVID, for most children who are vaccinated especially, the risk of severe disease is low. And for what we're seeing with a lot of these children is that the disease is actually quite mild. And so you have to think the risk of that versus not having your child in school. And perhaps if there are other risks in the household, that there may be a better way of reducing those risks as opposed to just simply putting a child out of school. But, once again, everybody has to make their own decisions on what they're most comfortable with.
Ben Cleary with NTV, do you have a final question?
I do, thank you. Dr. Fitzgerald, can you walk me through the changes being made to the COVID dashboard and why you think the time is right to start only updating the numbers once a week?
Yeah, so basically that's what the change is going to be, is that we're, instead of updating it 3 times a week, which is what we're doing right now, is it'll be just once a week on Wednesdays. So all the information will be updated at that time. I think we're seeing a reduced transmission, and we're seeing changes in our surveillance. So we need to reflect that in our reporting. So we're reporting now much in the same way as we do influenza, which is a weekly public report.
Thank you.
Peter Jackson of the Telegram, do you have a final question today?
Yes, just one question about rapid tests. We're hearing that a lot of parents have built up boxes and upon boxes of these tests. And meanwhile, there are still people, older people, vulnerable people, who can't access them. When they do, and they fill out the self-assessment form, they're told not to get a PCR. Do you feel that the rapid test decisions you made were wise in that light?
So right now, rapid tests, are being distributed widely in schools through the RHAs and through other vulnerable groups. And we are certainly looking at the best way to use rapid tests going forward. And we will be, re-examining that as part of our COVID management plan for the fall and into next season. At this point, we feel that the decisions we made were the decisions that would give us the best information. Anyone who was in a high risk category, anyone who was over the age of 60, anyone who had medical illnesses, anyone that had conditions that would make them potentially eligible for medication, all of those people could still get PCR testing. So testing was available to people and to the majority of the population. And we certainly are, we've heard the feedback, and we certainly will be looking at how we use rapid tests most effectively going forward.
And Noah Shepherd with VOCM, do you have a final question?
I do. We've seen this with previous or with the lifting of previous restrictions that as they coincide with sort of scaling back the information reported. So in this case, with the portal now only updating once a week, people say that they aren't getting enough information to make a informed decision to protect themselves. How do you respond to that?
So I think at this point, the information is not changing significantly from day to day. And if we were to see sudden changes in, our incidents, if we were to see that there was something else happening with regard to new variants, for example, or anything along those lines, we certainly would be coming out and making recommendations or informing the public of those things. So at this point where we are, what we're seeing with our caseloads, and that the prediction is that things will continue to improve over the coming weeks, we feel that this is a good time to make that decision to report once weekly. And I think that information will still be able to inform people's decisions.
Thank you, everyone. Dr. Fitzgerald, would you like to make any final comments today?
Well, no, thanks everyone for joining us, and certainly encourage people to still get their boosters. I know we're thinking that we're in a lull right now, but it is still really important to get your boosters and make sure you're up to date with your COVID vaccination. So check our website just to make sure that you are, and stay safe. Take care, everyone. Thanks.
Thank you, Dr. Fitzgerald. And thank you, everyone, for joining us today. Please stay safe and enjoy the rest of your day.